come to all of us first. I'm happy to have with me today 3 young ladies, very familiar in our community. If you've heard of Bpt Physical Therapy, and I know all of you have with their creative commercials, I hope you know about Bpt Kids, and that's what we're going to talk about today, because there's so much that's involved with that, and I want to find out more information. So thank y'all for being here today.
Thank you.
Now tell me your names. Introduce yourselves to me.
So I'm Amy. I work in physical therapy.
And I'm Kelsey. I work in occupational therapy.
And I'm Miranda, and I work in speech therapy.
Okay. Now, when we talk about Bpt Physical Therapy, there is a division of that, Bpt Kids. So that kind of tells me you're dealing with kids. But I want to know what you do with children. So tell me a little bit about the services that you offer with Bpt Kids.
Yeah, so Bpt Kids is our pediatric outpatient clinic. So we service children from birth to young adulthood, and we offer speech therapy, occupational therapy, and physical therapy.
All right, now when you talk about speech therapy, occupational therapy, and physical therapy, I'm thinking to myself, okay, physical therapy, maybe something with the hands or the feet, but it's much more than that. So tell me, what are maybe some of the misconceptions that people have, like myself, that don't quite understand it?
Yeah, so we'll start off with physical therapy. So when we talk about physical therapy can work on a variety of things, but typically when we're working with pediatric physical therapy, we mostly work on strengthening and coordination. So when we talk about coordination, that just means that we're looking at complex movements with the child. So like, take for example, climbing a ladder. So that takes much more things that go into it than we think about on a daily basis. So when we're talking about a kid climbing a ladder, they need to be able to use their arms and their legs and be able to sequence that movement at the same time. So for us, we can help the child work on coordinating those movements and help them make that movement a little easier for them to complete. We can also work on strengthening, but when we talk about strength, we're talking about what the child needs specifically. So every child might have a different kind of injury. So for example, if they come in with a broken leg, then we want to work on leg strength. So there are a different variety of things that we can work on, but typically strengthening and coordination are the ones that we work on the most with children. The common misconception though with physical therapy is that we might just play with the child, but that isn't necessarily true. While some of our treatment sessions might be play-based and be interactive with the child, we're actually targeting a very specific goal and specific movements with the child. So,
well, when I hear you talk about playing with that child, and I'm sure it might be a little scary for a child when they first come in, not understanding, what this is all about.
Right.
So you've got to make it fun for them.
Yes, ma'am.
At the same time. But then how does occupational therapy blend in?
So occupational therapy addresses a very broad range of things. So pretty much anything that a child needs to do in their daily routine is something that we're going to look at. So our biggest things are going to be their fine motor skills, which is how their hands are working together, how their hand muscles are formed and how they're working. Their bimanual coordination, which is how, can they use both hands together to complete a task. Their visual motor skills, so can they break down worksheets? Can they break down their task they need to complete every day? Their sensory integration, which is just how our bodies process the outside world. And for some children, their bodies process outside stimuli a lot different than we would. Their self-care skills. So can they bathe themselves? Can they dress themselves? Can they tie their shoes? So occupational therapy can be very, very large scope of practice. So we're just looking at anything that they need to do throughout the day is going to be important to us. And as like Amy said, a misconception can be that we're just playing with them. But from, untrained or unskilled eye, it does look like play. But for a child, play is the building block for development. So that's how we are able to facilitate growth, is through playing with them.
All right, so we're talking about physical therapy, occupational therapy, speech therapy. Now, I'm thinking, okay, with young children, they might have speech delay, they might have a problem with speech, but how much involvement do you have with speech therapy?
Yeah, so with speech therapy, that is actually one of the common misconceptions, is that we only target speech sounds or helping children speak, when in reality we cover a whole wide range of skills. So going along with what Amy and Kelsey were saying, play is also a common misconception among, I think, all of our therapies. But so as a speech therapist, let's say I had a kiddo who was not using very many words, or they were having trouble following directions, I would choose something like maybe a barn play set, and we could work on them imitating animal sounds, like saying moo or ba, or like, oh, let's put the cow in the barn, or oh, let's pretend we're riding in the tractor. So even though it might look like we're just playing with a barn set, we're doing so much more. And so speech therapy also works on just language in general, improving a child's language skills. So whether that be improving their knowledge of vocabulary, their understanding of basic concepts, so being able to name colors, shapes, understanding prepositions, so in, on, under. We also work on helping them improve their grammar and literacy skills, so helping them read and write, which is so crucial to our school age kiddos. We can also work on social and pragmatic skills, knowing how to greet other people or interact socially, knowing how to play with your peers. We can also work on fluency, which is like stuttering, so helping kiddos' speech be more smooth, not so bumpy. And then we also work on executive functioning and problem solving skills. So being able to think critically, as it's such an important skill as they get into that school age. And then the last thing that you might not think that we work on is swallowing. So we can help strengthen a child's muscles in their mouth, tongue, throat, not only for their speech, but to make sure that they are able to swallow safely. So that's sort of our scope of speech.
Well, you know, when I'm listening to all of this, and I'm thinking sometimes parents might not recognize that there is a problem. It might take a teacher or someone else that says, hey, I think there's a little bit of a problem here. Maybe you need to get some therapy with that. So tell me, what type of conditions or diagnosis would you work with when it comes to children?
So one very frequently seen diagnosis is autism. So at Bpt Kids, we all typically see children with an autism diagnosis. It's just each discipline is going to, target things from a different angle. Autism, or it's also known as autism spectrum disorder, or ASD, is just that. It's a spectrum. So all of these symptoms are going to present very differently. You can have, the very mild symptoms to the very severe, and this is also usually diagnosed between the ages of 2 and 5. Typically, from an occupational therapy standpoint, with a child with autism, we're going to look at the handwriting, we're going to look at the visual motor skills, the self-care skills, but we really focus in on their sensory processing differences, because typically, a child with an autism diagnosis is going to have some sort of difficulty processing the outside world. So whether it's they are very overstimulated, which is going to lead to a lot of movement seeking, you may see a child bumping into a lot of things, or rocking or spinning, or constantly running back and forth, or wanting to climb to high surfaces and then jump down. That's something that can really impact their success throughout the day. Or on the other side of the spectrum, you may see a very understimulated child. So this may be a child who is not responding to their name. They prefer to play, say, by themselves with a very specific set of toys in a very specific manner, without a lot of engagement with the outside world, or parents or teachers or peers. So as OT practitioners, we're going to work really hard to develop what we call as a sensory diet, and this can be implemented in the home, in the school, within the community, to just help facilitate a better understanding of the world, give them resources and tactics to help their bodies process the world in an easier manner. So this may be, a weighted vest for a child that's seeking a lot of movement, just to help them be able to calm down and focus, or a few protocols that we have to increase, their tactile sensitivity, so to be able to tolerate different textures on their skin. Every child is addressed in a very different manner, and we really break down each child, their each specific set of needs with an autism diagnosis to best help them reach their maximum potential every day. If you do have concerns with your child, please be sure to discuss that with your pediatrician. But yeah, so for OT, that's typically what we do with a child with autism.
When you talk about autism, and I think a lot of people don't quite understand autism unless you have a child and you go through the process of trying to get that child help. So with autism, speech, how do you deal with a child that had autism and speech therapy? How do you bring that child to the fore?
Right.
Bring it out.
Being able to know who that child is, right? So like Kelsey said, we see a lot of kids, and it does range on a spectrum, right? So for some of our more intensive need kids, sometimes they are what we call nonverbal. So basically what that means is they just do not use speech or unable to use speech like you or I would to communicate. So as speech therapists, we have to offer them ways to communicate, right? So one way that we do that is called an augmentative and alternative communication device. And that's just a fancy way of saying offering them a different way to communicate. So it could be something as low tech as having a strip of paper and you have different Velcro choices on it. So let's say you're working on a child and getting them to request more of something or being able to communicate when they're all done, right? So the child could rip off that choice that they want to make and hand it to you instead of using their words, and that would still be a way for them to communicate. So that would be like a low tech side of it. And it could always range up to a higher tech side with something like an iPad. And on those iPads, we usually have different apps that are used specifically for communication, and they would hit a button and it would speak for them. So you can just use words with that, or they can start to develop and use full sentences with that device if they are unable to speak themselves. So for our less intensive kiddos with autism, that's where we get to work on some of the nuances of our language, right? So sometimes you think about like body language or social interactions. We're not explicitly taught how to interact with other people. It's just something that we observe. And sometimes our kiddos with autism, they don't necessarily pick up on those social cues, right? So we have to teach them like how to greet people properly, or like how to initiate or participate in conversation rather than just be sort of in their own world. Because you oftentimes see a lot of kiddos with autism, you almost see that they are in their own world, and we are helping them to realize there are other things and people around them, right? And then so with that sort of the higher level language skills, you oftentimes see that figurative language and humor might go over their head, or they don't fully comprehend that. So we help break that down and help them understand all those different meanings. So those are some different things that speech works on with those with autism. So.
With autism, it seems almost overwhelming. But you're talking about the speech, you're talking about the occupational side of it, but there's also a physical side of autism.
Yes, ma'am.
How do you deal with that?
So for the physical therapy side of things, typically when we have a child come in with autism to the clinic, one of the main things that we see with most children with autism, not always all the time, but most of the time, we see that they toe walk. So when we talk about toe walking, that just means that the child will walk on their tiptoes versus walking on their heels like we would do. So when we see that, we want to work on strengthening the muscles and stretching the muscles out, so that way we can help decrease some of that toe walking. We also want to help educate the parent and work on some exercises to help decrease that habit, because a lot of times the kid will form a habit of walking on those tiptoes and it kind of just becomes repetitive. So we want to try to break that habit up and get them to walk with a more normal gait pattern. So we also can typically see with children with autism, for physical therapy side of things, that the child might have some issues with some coordination activities. So a child should be able to kick a ball, run, jump, climb a ladder, all those type of activities at a certain age appropriate time frame. So typically with children with autism, they might be a little bit behind on some of those skills. So we want to help them be able to facilitate these movements and be able to complete these movements at an age appropriate level. So that way they can go out and play with their peers and go out in the world and be able to do these activities. So that's a lot of what physical therapy works on. But there's some other things too that we address with kids with autism, but those are typically like the main highlights that we see.
You know, it sounds like you cover the bases when it comes to autism.
Yes, ma'am.
Yes.
And it's good to know that there is a place where a parent feels comfortable in taking their children and knowing that they're going to get the help that they need. Because autism, you know, I've talked with parents with children that are autistic, and it can be overwhelming for them.
Absolutely.
It can, particularly if there are other children in the home
Yes.
Right.
that they're having to work with and deal with, and then having an autistic child.
Yes.
Exactly.
So you cover the bases when it comes to autism.
Right.
All right, now what are some of the other?
And I was just going to say, we just want to make sure too that we can't diagnose autism, so that's why it's so important to talk to your child's pediatrician so that they can get the proper referral and care that we need, and then come to us. So.
Right. Right. All right, now what other diagnosis do you deal with?
So another diagnosis that we deal with a whole lot is a developmental delay. So that looks different for each discipline. So for speech, it might be they are not using words at appropriate ages, or we're having some delays in just our language skills, vocabulary. For occupational therapy, it might be we're not able to dress ourselves, or we need extra help brushing our teeth or doing some of those daily care routines. And for PT, it might be we're not crawling or walking at appropriate ages. So there's just an overall delay in some of those skills. Now, for speech therapy, we oftentimes do see kiddos who can't produce sounds correctly, or they are not producing sounds that they should be. So what we would do is we would get sort of like an inventory of what sounds they are saying, which ones they're saying correctly and incorrectly, and for those that they are not pronouncing correctly, we offer them ways to help form their mouth or move their tongue or lips in a certain way so that they can produce that in the right way so that we can understand them more, right? So that cup isn't like tup, something like that.
Right.
And then we also work on some delays in language. Oftentimes you see that our kiddos have difficulty with understanding or following directions. So it's that comprehension, that understanding aspect. And so we break down different ways to help them understand what we're asking them to do, whether it be if it's a two-step direction, like go get your shoes and bring them to me. First breaking it down into, okay, go get your shoes. Okay, now bring them to me. And then seeing if they can put that all together, right? And so when we are working on these skills, not only are we helping them to communicate and to be understood, but we're helping them to understand, whether that be in the home setting or at school, being able to understand what your teachers are asking you to do. And so these skills just carry over to all aspects of a child's life. So.
And I'm sure there's different reasons why a child could be developmentally delayed. From, I'm thinking physical, to speech, but how does occupational therapy deal with that?
Yeah, so for occupational therapy with pediatrics, in many ways, we do tend to overlap with speech a little bit when it comes to, we want to make sure that a child can follow a direction or auditorily process information that they're receiving. But from an OT standpoint, we look a lot at their self-care skills. So, can you dress yourself? Can you button and unbutton a shirt or your pants? As far as, if you're a school age, you have to do those things throughout the day. Can you zip and unzip your jacket? And, can you go to the bathroom? Can you manage all of that? Can you tie your shoes? If I were to have a child who was 8 years old and we're not tying our shoes yet, we're going to break down those tasks for them. We're going to look at, is it the motor planning that we're having a hard time with? Is it the comprehension of the task? Is it the coordination of the task? So we really look to break down these individual aspects of what they're having a hard time completing or a delay in, and figure out the best way to catch them back up per se. We're also going to look at their fine motor skills. So is there a delay with the strength of their hand? So that carries over to all aspects. Can they write their name? Can they color a picture? Can they cut things out? And the visual motor piece plays an important part as well. Can you break down information that you're receiving to be able to complete a worksheet, in school? Or, if mom says, hey, can you go get your shoes for me, kind of like Miranda was saying, can you visually break down your environment to be able to find those items? So OT continues to be very broad with a lot of our diagnoses, but at the end of the day, as long, with developmental delay, anything that affects them throughout their day is something that we're really going to hone in on, and we're going to focus on to be able to allow them to function at their best level and to function, throughout the community with their peers, friends, family. So we really like to focus on the activities of daily living for these kids and provide ways to, to meet those needs.
When I'm thinking about a developmentally delayed child, it could be one or all three, couldn't it?
Yes.
Yes. It could be just speech,
Right.
but there's also a physical aspect of it. You've talked about tying the shoes.
Yes.
So how do you deal with the physical aspect of a developmentally delayed child?
Yeah, so for physical therapy, we're mostly looking at if the child is having a delay with gross motor skills. So when we talk about gross motor, we're talking about activities like walking, crawling, jumping, those kind of things. So the child should be able to do these things kind of at an age-appropriate level. So when we're looking at these things, if a child can't, let's say, walk, for example, we'll help teach the parent, okay, well, let's start walking with using two hands first and maybe encourage the child using a toy. And then once they progress, then we can start walking with one hand, and then eventually the goal would be to take independent steps. So we want to help just try to facilitate these movements and teach the parent how to help the child be able to complete these movements more independently, because that's the ultimate goal. We want the child to be able to do all these things by themselves. So for physical therapy, that's the side that we're looking at for the physical component of things. But for all of the things that we talked about for developmental delay, the big thing to remember is that we can't diagnose any of these things. So again, you would need to go to your child's pediatrician and let the pediatrician discuss with you if your child is at an age-appropriate level or not, and then we could go from there.
All right, we've been talking about children, and I guess I'm thinking to myself, with Bpt Kids, what are the ages that you see? Is it from 0 to 18? I mean, I guess that's kind of crazy, but does it start at 1 year of age?
It could start as little as like a couple months old to all the way up to young adulthood too.
Okay.
So some of our kiddos with maybe some more severe, all-encompassing diagnoses, we might see someone who is in their like early 20s as well. So maybe you've had a kiddo in like a special ed who's been in school longer than a typically developing child would. So we see a huge range.
Yeah, I was thinking about that when you mentioned special ed and children there that might not meet the age level there that you work with, still in the children's side of it.
Yes.
Okay, so you do that. All right, what other diagnosis do you, autism, developmentally delayed, what else do you work with?
We see a various range of diagnoses, and a few of them are cerebral palsy, Turner syndrome, Down syndrome, Fragile X syndrome, spina bifida, sensory processing disorder, oppositional defiant disorder, and ADHD. If your child has a diagnosis outside of the ones that we've mentioned today, that doesn't mean that we don't see them. These are just a few of the more frequently seen diagnoses in the clinic. So.
All right, and we talk about going to the pediatrician, and we all know that some parents just don't do that. They just don't do that. So once they get into school and a teacher recognizes that there is a problem, what could happen from there? Could a teacher, I'm just thinking to myself, I'm sure they would need to talk with the parent and recommend that they take that child to a pediatrician in order to get help and get a referral over. But how can people get in touch with you? Does it have to always be through a pediatrician?
So in order to get a referral for our therapy, you would have to go to your pediatrician.
Okay.
So if anybody has heard any concerns or anything that you're thinking, oh, maybe my child does that, or oh, I'm not sure about that.
Right.
I would suggest going to your pediatrician and discussing those concerns, and from there they would refer you for an evaluation to come and see us at Bpt Kids, and that sort of looks a little bit different for speech, OT, or occupational therapy and physical therapy, but we usually try to do like a standardized test just to see where like your child is at, what skills they have, what skills they might be lacking in, and from there we would make a recommendation on the services that they would need from there. So, but the first step would be having to get that referral from your pediatrician, because without that we can't really go any further in the process of that yet.
You need that recommendation.
Yes.
All right. Now, I was just thinking, so many children could, in life, there are challenges with children. And so many times you see children as they get older and you think, if they had only had some type of treatment when they were younger, how much different their life could be today.
Yes. Yes.
And
we're huge advocates for being, proactive instead of reactive.
Right.
So just, if you have a concern about your child and they need a therapy evaluation, it's not a bad thing. It can be, therapy can be very short-lived and they make progress very quickly, or it could be, a longer-lived thing depending on the severity. But it's not. I feel like sometimes there's a stigma around your therapy needing or your child needing services, but it's not. It's much better to advocate for your child and get them the services that they need versus waiting late in life and then wishing that they had something earlier.
Getting therapy's never going to hurt. It can only help. It can only be like, well, you don't need us, so okay, see you later.
No, and I think you pointed out something. Years ago, there was a stigma.
Yes, ma'am.
If you seek help, there's really something wrong with you. But sometimes you like yourselves, you have to put those pieces of a puzzle together and make them work. And not every child works and acts the same way.
Absolutely. So they're all different.
They're all different. Now, how can someone get in touch with Bpt Kids?
So there's a couple different ways to reach out to us if you guys have any questions about anything that we went over today. But we really just want to emphasize too that, like at BPT, we have our own type of culture. So we really just like to really help the child reach their fullest potential. That's our main goal. That's what we strive to do. And we really like to try to make that family and friend connection. So you're not just a patient to us when you come through those doors. Like, you literally are our family when you walk through. But there's a couple different ways you can get in contact with us if you have any questions. First is by calling us on the phone. You can call us at 276-622-3636. Okay. You can also go check out our Facebook page, which is Bpt Kids. And our Facebook page is really cool because you can go on there and look at some of the diagnoses that we treat and some of the treatment highlights of things that we do to help with that diagnosis. So it kind of just gives you like a little highlight of what we do day to day. And then our last way you can reach us is on our website online, which is at BassettPT.com. That's going to take you to our overall company website. So it does have our adult services and pediatric services on there. But we have a tab just for our pediatric services, so you can go on there and look at the services and the different specialties that we offer. So that's just a couple different ways to reach out. And again, if you have any questions, please reach out to us. We love to see new faces, make new friends, and we just really just love it working with the kids, and we love doing what we do. And we just appreciate you having us here today, Miss Deborah, and thank you for taking the time to let us educate you on some therapy needs.
Really, I tell you, and I think if you watch one of your creative commercials, you're located beside Food Lion
in
Stanleytown. But you know what that tells me? That tells me with these creative commercials, they also have a creative staff. And when you're working with children, you've got to be creative.
Yes, you do.
That's what you need.
Yeah.
Exactly.
Okay. Hey, thank you so much for being here today.
Hey,
You certainly educated me on things that can be done with children that do have, let's say, problems or situations that need some help. And that's what you're there for.
Exactly.
We are.
All right. Thank you so much.
Thank you.
All right. Bpt Kids. located in Stanleytown. You won't forget that because they're right beside Food Lion. All right, stay with us. We'll be back in just a moment.